Hello students, welcome to my YouTube channel Medico Education.
Today we are going to study about shock. Shock is the circulatory failure in which the blood flow is decreased in the whole body. Shock is a critical condition brought up by the sudden drop in blood flow through the body. Our body's response to sudden drop in blood pressure. There is a circulatory failure in the whole body. As a result, the blood pressure also decreases. When a vessel is constricted, the blood flow is increased, while when a vessel dilates, the blood flow will decrease. The question arises, is shock life-threatening? The answer is yes. When a person is in shock, the organs are not getting enough oxygen. If left untreated, this can lead to permanent organ damage or death. We can see a picture on the screen that is showing there is a source of infection which is affecting the lung. The bacteria enter the blood. There is a leaking in the blood vessels. There is a fourth step where all the organs are dysfunctioned or they are affected, which can lead to death. Signs symptoms of shock can be shaking, sweating, anxious, dizziness, fast heartbeat, impaired vision, weakness or fatigue, and headache. All these symptoms are related to shock. The causes can be trauma, heat stroke, blood loss, an allergic reaction, severe infection, poisoning, or severe burns. All of these causes can cause shock. Types of shock: cardiogenic shock, hypovolemic shock, anaphylactic shock, septic shock, neurogenic shock, and obstructive shock. Cardiogenic shock, as we can see the word cardiogenic, the word cardio is related to heart. So the cardiogenic shock is basically related to the heart. It is caused due to heart problems, example, heart attack, heart failure. You can see the heart in a very miserable condition in the image. So basically cardiogenic shock is related to heart problems, and if it worsen, a person can go into a cardiogenic shock. Hypovolemic shock. The second type we are going to study is hypovolemic shock. It can be caused by too little blood volume. It means it is related to heavy bleeding or dehydration. The volume of blood is decreasing, which is causing hypovolemic shock. Hypovolemic shock is basically inadequate plasma. How can we treat hypovolemic shock? We can treat by replacing the fluids and stop the ongoing losses. For example, if we see a person is bleeding, we should first of all stop that bleeding by applying pressure. In any case, we should stop that bleeding to prevent hypovolemic shock. Anaphylactic shock. As we can understand from the name, it is related to any allergic reaction. So, anaphylactic shock can be caused by any allergic reaction. Example, food allergy, insect bite, or medication. How can we understand an anaphylactic shock? There is a loss of consciousness, swelling of the tongue, and inability to swallow, rapid swelling of the throat tissues. Septic shock. It can be caused by any infection. Neurogenic shock. It can be caused due to damage to the nervous system. Neuro is related to brain, and when the nervous system is damaged, so it is called neurogenic shock. Continue to monitor vital signs. The first thing we have to do, and the priority based thing, is continue monitoring vital signs. What can cause a neurogenic shock? Injuries above T6 in the vertebral column can cause neurogenic shock. What are the signs symptoms that can be hypotension and bradycardia? Obstructive shock. It can be caused by physical obstruction in flow of blood. Example, pulmonary embolism. It's not just pulmonary embolism. It can be any obstruction in the blood. That can be embolus in blood. It can be air embolus, a blood embolus, a clot in blood. All these can cause obstructive shock. First aid of shock or unconsciousness. Lay the person down, elevate the legs and feet slightly. How the elevation of legs can help? This will increase the circulation of the patient to the upper parts of the body. Keep the person still and don't move uselessly. When a person is unconscious or injured, don't move the person uselessly. Only mobilize the patient when necessary, so the patient do not experience any deterioration in condition. If a person is not breathing or moving, begin CPR. If a person is not breathing, you should begin CPR, that is cardiopulmonary resuscitation. Loosen tight clothing and if needed, cover the person with blanket to prevent chilling. If the person is bleeding, hold pressure over the bleeding area using a towel or a sheet. Don't let the person eat or drink anything. Why should we restrict eating and drinking? Because it can cause choking or aspiration. If a person vomits or begins bleeding from mouth, turn him onto a side to prevent choking or aspiration. If you see a person is vomiting, the vomitus, the material he is vomiting, can be aspirated. Turn him onto a side to prevent choking or aspiration.